Inflammatory arthritis describes a range of conditions where there's inflammation inside the joints, and so that causes joint pain and swelling. In inflammatory arthritis, the body's immune system, which is just supposed to fight infections, starts to attack the healthy tissues of your own body, in this case the joints. So some common examples of inflammatory arthritis include rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. Early diagnosis and treatment of inflammatory arthritis is really important, not only to control symptoms, but we know that if we treat it early, we have the best chance of controlling the disease and preventing it from causing permanent joint damage and deformity. If people are concerned that they might have symptoms of inflammatory arthritis, the first step is to see their GP, and then if needed, that they can be referred on to a specialist like a rheumatologist. The aim of treatment is obviously to control symptoms, but also to actually control the underlying disease so that we can prevent the permanent joint damage and deformity which can occur if we don't treat inflammatory arthritis. Sometimes it can take a while to find the right treatment for an individual person. We may need to trial a few different medications or combinations before we get the right one. There are a variety of medications which can be used to treat inflammatory arthritis. Most commonly, the first-line disease-modifying agent that we use is methotrexate. Disease-modifying anti-rheumatic drugs are often referred to as bDMARDs. Methotrexate is a medication that we use to control the excessive immune response which is happening in inflammatory arthritis, so that we stop the inflammation in the joints and therefore prevent long-term damage to the joints. Some people are worried because they think that methotrexate is chemotherapy. And although it is used as chemotherapy in some forms of cancer, the way that we use it to treat arthritis is very different. The doses are much lower. We've been using methotrexate to treat arthritis for decades now, so we're confident that it can be used safely and effectively. Some of the most common side effects of methotrexate are nausea or stomach upset, as well as fatigue or brain fog. And some of these symptoms can be improved by using folic acid supplementation. The first line of treatment in ankylosing spondylitis is generally a combination of exercise as well as medications. No matter what medication you end up taking for ankylosing spondylitis, exercise is vital to not only improve symptoms but to maintain range of movement in the spine. The most common first line medication is a non-steroidal anti-inflammatory drug. We generally start treatment with conventional disease-modifying anti-rheumatic drugs, but if these aren't sufficient to control disease, and then we can use medications such as the biological or bDMARDs that target very specific aspects of the immune system to stop symptoms and the progression of disease. For biological bDMARDs, people may get a reaction around the injection site if it's an injection that they do under their skin. Also, these medications do suppress the immune system, so people are at higher risk of getting infection. A flare is a period when your arthritis is more active or more severe than usual, and this can last from a few days to several weeks. Now, in a flare, patients might have increased joint pain, swelling or stiffness. They also may feel more fatigued than usual. It can be triggered by a change to the medications. It can also be triggered by other illnesses such as an infection or by stress or injury. It's good for patients to have an action plan of what to do if they have a flare. This can involve a combination of self-management techniques as well as medications. So for example, people may have to rest a bit more, they might use heat packs or ice packs, and they also may have some medication that their doctor has given them, such as a non-steroidal anti-inflammatory or a short course of glucocorticoids to help manage a flare. Sometimes after a patient has been well controlled for a period of time, say for at least 6 months, it is possible to reduce some of their disease-modifying medications and still maintain disease control. Dose reduction or down titration of a biological disease-modifying agent is when we reduce either the dose or the dosing frequency of the medication. If patients are interested in reducing their medications, they should speak to their rheumatologist about this so they can work out the best regimen for reducing the dose, and also to know how to look out for flares and what to do if a flare does occur. There are a lot of things that people can do themselves to help manage their arthritis. So we encourage people to have a balanced diet and maintain a healthy weight. We know that smoking is associated with more severe arthritis, so we encourage people who are smoking cigarettes to stop smoking. Also, exercise is really important for people with arthritis, and it may be helpful to see a physiotherapist or an exercise physiologist to try and work out what forms of exercise would be best for an individual.